Hi everyone, Patrick Meninga here, spiritualriver.com. I want to talk to you today about outpatient treatment for alcoholism and drug addiction. Now there's a whole spectrum of treatment services and they range in different intensities from basically very minimal to very extreme. So at the minimal end you might have something like going to see a therapist or a counselor for an hour each week. And if that's all you're doing, then that's really pretty minimal as far as treatment. Now, at the other end of the spectrum, you have long-term treatment where you're actually living in a rehab center for over a year. That would be the other end of the spectrum. That's the other extreme, is very intense treatment. It's all day, every day, and it lasts over a year or up to 2 years even. So on that spectrum falls the solution of outpatient treatment. So outpatient is very similar to inpatient rehab, like a 28-day program where you go to various groups, but each night you go home to your own home and you sleep in your own bed, and then the next day you come back into rehab and you take some classes and go to some meetings and talk to a therapist. And so outpatient can be somewhat intensive, but generally it's never going to be as intensive as a 28-day inpatient program or a long-term program. And so what I would suggest for someone who's interested in outpatient is to use it as aftercare. So if you go through a 28-day program where you sleep in a facility overnight for 28 days, that follow-up to that might be good is outpatient therapy. It's certainly better than nothing. Some people aren't willing to do inpatient. They're not willing to sleep in a treatment center and stay there for 28 days overnight. And so I would encourage such a person to at least give outpatient a try. But what I would also caution you is that if you've tried to get clean and sober, if you've struggled to get clean and sober, and you're still struggling today, then maybe outpatient treatment is not enough help for you. That at some point you might have to get honest with yourself and say, okay, whatever I've been doing in terms of treatment hasn't worked for me, and therefore I need to do something more intensive. And so if outpatient treatment has failed for you in the past, then you might consider the idea of checking into a 28-day program, going through a medical detox, and going through residential inpatient services. That's what worked for me eventually. And if you're struggling, then that might work for you too. So consider that idea, pick up the phone, call up a treatment center, ask them what it would take for you to get into inpatient rehab, and then hopefully you can turn your life around from there.